And Dr. Ashley DeMarco with Gulfside Dental joining us now. Today we're talking about braces and really the ever so concerning time for braces. A lot of people, are not sure about their kids, and I feel like a lot of times people are saying it's getting younger. Tell me what the best age is, you think, Dr. DeMarco?
Well, the American Academy of Orthodontics says that your child can be screened as early as 8 years old.
Okay.
And that would be if they had something going on that you could already see severe crowding, and we might do something called phase 1 orthodontics, which would be we put a few brackets on a few teeth and we help get things straightened up before all of their adult teeth come in, to hope that they don't have to have a surgical procedure later on.
Okay.
But the actual age that you start seeing kids have braces is when they've lost all their baby teeth. So, in girls we see that probably as early as 10, but more along the lines of 12. Okay? And boys are a little bit later than girls with that.
And how long do they typically have to wear braces?
Well, it completely depends on, one, how much work the orthodontist has to do.
The severity, I guess,
right,
of it? Okay.
The severity, and then how compliant the child is. Are they wearing their rubber bands? Are they breaking a lot of brackets, and so on and so forth? But the average time is about 2 years.
Okay, about 2 years.
Yes.
And there's different options. I think you touched on that a little bit, but tell us a little bit about the braces options. Maybe if it's the bracket, some people don't always have to wear the rubber bands, I guess. You don't always see that.
So there's the traditional braces that are the silver brackets that everyone sees with the little colored rubber bands that go around them.
Yeah.
And that's just what, the normal that you see all the time. There are ones that have clear brackets on top. You can do clear on top and bottom, but a lot of times we just do the clear on the top.
Okay.
And those are porcelain brackets, and that's available. Usually we do that for teenagers that are a little more self-conscious, or adults that want to have braces placed.
Yeah.
And then there's also the Invisalign option, which is the clear, almost trays that you wear over your teeth that are very hard to tell unless you look very closely.
A lot of adults do that too. I think I've seen that more often, maybe, if they just didn't get it done when they were younger.
Exactly. And they even have Invisalign for teen, but a lot of times we don't recommend that because a lot of teens, you still have the same kind of, it's not a really bad pain, but it's a pressure pain. And with Invisalign, you can take them out. And so you have to know it's a very dedicated teen that understands that their parents are paying a lot of money for them to have braces, or it's an adult that had to pay for them themselves and appreciates that they are going to wear them and do what they're supposed to.
Absolutely, because that, of course, could mess up the treatment part. And what's so good about Gulfside Dental, too, is when you work with people on, of course, how they're going to do it, paying for that and all that.
Exactly. We have wonderful payment plans, and we actually have a lot of openings this summer because we know a lot of parents want the children to have their braces put on in the summertime, and just do the adjustment appointments throughout the school year. So we have definitely a ton of different payment options and payment plans, and we're one of the lowest priced in the Golden Triangle for braces.
Which is very helpful. And of course, getting that figured out, like you said, it depends on the different teenager or the adult. So really, just the best thing is just to call and ask you to set up that appointment.
And if they mention that they saw us on Fox 4, we can do free consultations for braces. They just have to mention that they saw us.
Hey, that's a great deal, too. That's very helpful. Thank you, Doctor. We appreciate that.
You're welcome.
Stay with us. We'll be right back.